Switzerland's Federal Act on Radio and Television illustrates the nation's proactive approach to protecting minors from unsuitable programming. Broadcasters are legally obligated to consider the potential impact of their content on young audiences, particularly by scheduling sensitive material during times when children are less likely to be watching. This aligns with Switzerland's broader drug policy, which operates under a four-pillar approach: prevention, treatment, harm reduction, and law enforcement. The goal is to balance public health with individual freedoms, emphasizing prevention as a critical component. By shielding children from media that glamorizes drug culture, Switzerland reinforces its preventative measures, aiming to reduce early exposure to narratives that could normalize or encourage drug use. Hollywood and drug culture. In contrast, Hollywood often promotes drug culture in ways that are accessible to young audiences, either overtly or through glamorized portrayals in movies, television, and social media. This promotion frequently overlaps with content marketed to children and teenagers, portraying drug use as a form of rebellion, sophistication, or fun, without adequately depicting the serious consequences. While the United States does have rating systems such as the MPAA, these systems are less restrictive in ensuring that minors are shielded from drug-positive messaging. Content promoting drug culture often slips through under broad cultural assumptions about creative freedom, resulting in pervasive exposure to glorified drug narratives. Comparing outcomes. Switzerland's policies focusing on limiting exposure and fostering prevention have led to dramatically better outcomes in combating drug abuse. Rates of drug use among minors in Switzerland are comparatively low, and the country has a robust system of harm reduction such as supervised injection sites, which prevent overdoses and facilitate treatment for addicts. By contrast, California and the broader United States face significant challenges, with high rates of youth exposure to drugs, early experimentation, and eventual addiction. The United States' leniency in allowing media to glamorize drug use to younger audiences contributes to a culture that normalizes drug experimentation, undermining preventative efforts. Summary. Switzerland's balanced strategy, emphasizing prevention through thoughtful media regulation and public health initiatives, demonstrates a clear commitment to shielding minors from harmful influences, including glamorized depictions of drug culture. In contrast, California's media landscape, heavily influenced by Hollywood, lacks similar restrictions and inadvertently promotes drug culture to impressionable audiences. The outcomes of these differing approaches are stark. Switzerland sees lower rates of drug abuse and better public health outcomes, while California continues to grapple with a drug crisis fueled in part by cultural permissiveness and insufficient regulation. Switzerland shows that responsible media practices can play a critical role in fostering healthier societal norms, particularly for younger generations.